course, you're good friends with Dr. Bartlett, and he's going to be here, Dr. Richard Bartlett, through all of COVID. He was here, and he's an emergency room doctor here in Texas. Very much loved and respected and honored even by our governor. And he found that using budesonide helped his COVID patients, which is something that you inhale, right? And so what happened with him and that whole thing?
Yeah, Dr. Richard Bartlett is a godsend. He's one of my favorite human beings on the planet. And in fact, when my own 94-year-old grandmother was struggling to get her oxygen level above 90 during COVID, I called Dr. Bartlett, and he told me what to do with budesonide and how to use it. So budesonide is a corticosteroid. So anybody that's ever used an asthma inhaler, that is a corticosteroid, and budesonide is one of these. So budesonide is already FDA-approved, safe for all preemie babies in NICUs, newborn ICUs, all the way to people over 100 years old. It's been FDA-approved, safe and effective. And Dr. Bartlett stated very early on in May or June of 2020, he did a huge interview that went viral around the world, seen by 5 million in one day, saying that you don't have to be afraid of COVID. We have a cure. It's budesonide. And he talks about being in the hospital on his ER shift and laying down and praying to God, how do I help these people? And he was actually told budesonide will do it. And his experience, his education is bar none.
And so what happened? How did the medical community respond?
They destroyed him in the media. They
destroyed him.
Destroyed all faith, respect in Dr. Richard Bartlett, who has been respected by politicians and governors in Texas for years as an advisor to Rick Perry here in Texas. And then a few months later, after he's being destroyed and people are saying, don't listen to him in the mainstream media, Oxford University in England decides to test his theory and his claim that budesonide was a very quick cure for COVID-19 patients. And they not only did it once, they did 2 studies and confirmed in both cases that budesonide, when used in COVID-19 positive patients, 90+% of them survived.
Okay, folks, there you go. The other, I'm thinking about Simone Gold and the Frontline doctors. Remember, she was there in LA and used hydroxychloroquine and then saw a patient recover early 2020 and then was reprimanded and told she could not use hydroxychloroquine. And you know what they did to the Frontline doctors. What did the media do to them?
Same thing they did to Dr. Richard Bartlett.
Tried to destroy them, their
Same
credibility.
thing they try to do with me. It's easier with me. They can just say, dismiss him. He's a retired chiropractor.
And I remember
don't listen to him.
when Dr. Pierre Corey was here, and he was the one who testified before the Senate about ivermectin.
Yes.
And he was just as excited as Dr. Bartlett was, because he felt like this was a breakthrough, one of the safest, I'll let you talk about it, drugs in the world. And this was early on and thought he would be embraced. Instead, what did they do with ivermectin?
Yeah, so ivermectin, what did they do with the media? They decided to tell you all that this is a veterinarian drug used for horses only. So they called it horse paste and made everybody that used it look like they were ridiculous and dumb. When the truth is, in every CVS and Walgreens in America, every pharmacy in America that human beings go to get their prescriptions filled carry ivermectin and hydroxychloroquine. So these are not animal drugs only. And in fact, ivermectin won a Nobel Prize in medicine in 2015 or 2016 for curing multiple human diseases, not horse diseases.
Right, and ivermectin has made a huge difference since. What are they saying now about ivermectin?
Yeah, so there's a big move right now to make ivermectin in the United States an over-the-counter medication because it has been so successful at helping to reverse and prevent COVID-19 symptoms, help some people reverse long COVID symptoms, and it's being published to help cure cancers all around the world.